Hey you guys, I'm Dr. Jacqueline Schakowsky, a doctor of chiropractic at Minnesota Women's Care as well as WomanWoRX. I'm here today to give you some information about chiropractic care. Okay, I want to first start off by talking about chiropractic care and consistency. Okay, chiropractic care is a lot like anything else in life, right? If you stick with it, you see changes happen. So I want you to just think about with, say for instance, fitness, right? Going to the gym one time, do you think you're going to implement change in your life, right? Or eating a salad one day out of the week, again, maybe not enough to implement change. So the beauty of chiropractic care is that consistency may most times lead to physical changes. Okay, so I also want to put a disclaimer in here and bust the myth that once you start coming to a chiropractor, you have to keep coming, right? I like to bust that myth right off the bat, okay? Actually, as chiropractors, we want to see you get results and see you improve, so we actually want to end up seeing you less and less and less in the office, right? We want to see you more as a maintenance or a wellness patient that comes in because you know how good your body is designed to feel, and so you only need your adjustment once every other week, right? And simply to maintain feeling good and keeping your pain symptoms away. So I like to bust that myth just right off the bat. I think that that's so important to talk about. The next thing I want to talk to you about is the chiropractic adjustment, okay, and what the chiropractic adjustment actually corrects in the spine. So as chiropractors, we use the term subluxation, okay? You may have heard that term before. This may be the first time that you have ever heard subluxation in your life, okay? And to a doctor of chiropractic, what that means specifically is a bone out of alignment, okay? And with that bone out of alignment, things can happen. So if your bone is subluxated, you may be experiencing pain, you may be experiencing a muscle soreness, right? Or you also may be experiencing, say, numbness or tingling in certain parts of your body, okay? So a subluxation is just a fancy schmancy term for a bone out of alignment or a bone that is misaligned in the spine, okay? What chiropractors do is we adjust that bone specifically to put it back into alignment so that the spine can function, right? And also the nervous system, brain, spinal cord, these are called peripheral nerves here coming out of the spine, that they can function at optimal potential, okay? And then therefore meaning that you operate as a whole body system at your optimal potential. So with these subluxations that we adjust, you may hear things such as pops or cracks, okay? We call those cavitations. And I won't get into the chemistry behind it, but what I want you to know is that when we do adjust, and you may hear those pops or those cracks, what that's actually doing is putting the bone back into alignment, as well as instilling mobility in the intervertebral discs, okay? So these little fluffy, almost like water balloon type of looking things in between the bones, those are called intervertebral discs, okay? And instilling motion into them allows us to have positive things such as, just for an example, improved range of motion, meaning you feel like you can maybe finally take a deep breath, or you can bend forward a little bit further, right? Depending on what region of the spine we adjust on you. So adjustments can also assist with decreasing pain symptoms, right? So sometimes people may say, oh, I have a knot type of pain in my back, right? It can assist with decreasing pain symptoms with that. It can assist in increasing mobility. So like I said, maybe you can bend forward more towards your toes. Okay, another thing that it can assist with is balancing the pelvis. So say you are pregnant, right? Chiropractic care is safe for pregnancy. It may assist in any sort of pelvic dysfunction or misalignment that you may have in your body. It also may assist with pelvic pain that you are experiencing, okay? And that can mean the pelvis is in this general region, right? So it could be low back, it could be the hips, things like that. So it assists with pelvic pain as well. The adjustment also helps with posture, right, or alignment of the body. So when you are feeling better, it's easier for you to hold yourself, right, in neutral posture. So that's another great thing. And then another amazing thing that the adjustment can do is assist with biomechanics. So again, that's just a fancy term for how the body moves, right? So you may be able to, when you're driving, say rotate your head, right, and look in your blind spot with more ease. So those are just a few of the things, the positive things that the adjustment can do for your body. Okay, so with the adjustment, one thing I do want to talk about is experiencing muscle soreness following adjustments, okay? I like to touch base with every single patient that I see that following an adjustment, you may experience a little bit of muscle soreness, right? You may experience maybe a moderate amount of muscle soreness, right? It kind of ranges patient to patient and case by case on the severity of that and your individual case. So the reason why patients may experience muscle soreness following an adjustment, say they have maybe never been to a chiropractor before, it's been a long time since they've seen a chiropractor, or maybe they're seeing a different practitioner, right? Maybe you have switched from one chiropractor to another, or there's multiple doctors in an office that can treat you, and they may adjust just a little bit differently. So the muscle soreness that may accompany or that may come after your chiropractic adjustment is just due to the body recognizing change that's happening, okay? So when we move the bones and we put more mobility into the spine and into the body, there's muscles that are attached to those bones, right? So the muscles may recognize this shift, and it's a great thing that our body has this defense mechanism saying, oh my gosh, this is something brand new, or this is a brand new practitioner that's giving me an adjustment. The body recognizes that new set of hands or a change, and the muscles fire up their defense mechanism and may be sore, right, following the adjustment. So that's just one of the reasons why you may experience muscle soreness, right? Your body may also not be used to the amount of mobility, right, that you now have in your body following that adjustment, okay? If your body is used to you not being able to bend over as far, right, it may say, oh my gosh, this is something new, this is something different, right? I need to, quote unquote, try to protect this person, and so it might fire up that muscle soreness. So that may be the body's defense mechanism to resist the change, right? And so gradually over time, again, coming back to that consistency piece with chiropractic care, that should become less and less and less, and it should get to the point where you don't get muscle soreness anymore following the adjustment. The last thing that I want to talk about with chiropractic care is that chiropractors work to get to the root cause of your symptoms, okay? So when you do come in for your initial evaluation, right, and we gather all of the information about you, and we do tests such as ranges of motion, orthopedic tests, muscle testing, reflexes, we'll palpate the tissue, meaning that we'll poke in and see, you know, where you're feeling muscle soreness or where you're feeling pain, and we'll try to get to the actual root cause, okay? What is causing that pain for you? So a byproduct of getting to the root cause of your symptoms is that you may feel more vitality in your life, okay? So you may come into the chiropractor to treat certain musculoskeletal conditions, right? Such as headaches or low back pain, mid back pain, feeling restricted when taking a full breath, something like that. And while yes, we want to focus on getting you results and decreasing the amount of pain that you have, right, currently present, another byproduct may be you may feel like you sleep better at night, right? You may feel like you can exercise a little bit harder, whether you're taking group fitness classes or you're exercising on your own. It may also lower stress levels, right? And you may feel, like I said, you have increased vitality in more than one area in your life. If you have any other questions regarding chiropractic care, please don't hesitate to reach out.